So if you've been having lower back pain that's radiating down your legs and you haven't been able to manage it, this video is for you. Hi, I'm Dr. Gregg Gerstin with Align Wellness Center, and I've been working with people for the last 20 years to help remove blockages in their health so they could live amazing, fantastic lives. Today I want to talk with you about a problem that shows up for adults who have had reoccurring episodes of lower back pain. And it typically shows up when we've managed episode to episode, pain to pain, and getting out of pain, but never took care of the cause of the problem. Someone's maybe never told you what the cause was or was never dug in to figure it out. But what happens is that the spinal degeneration winds up developing. So if you've been told that you have that, put your hand up, hit the like button, say that this video is for you. If you know someone who's had spinal degeneration, can you share this video with them so they can get the steps and understand what's going on and hopefully avoid some of the more advanced things that go on? You may have even had episodes where you've had epidurals provided, or you've wound up being consulted or talked about having a surgery, or had a microdiscectomy of your lower back to manage the chronic spinal degeneration that's developed. When this winds up occurring, every episode that you have, the spine changes positions and becomes that much more permanent. And typically what happens is when we look at the lower back from the side, you can see that there's a curve through here. Now, each episode that occurs, the spine winds up flattening and straightening out. As you can see, the spaces between the bones wind up diminishing and becoming smaller. These changes wind up leading to instability in the lower back. And when the back spine doesn't have stability from the side, which the arches provide, it'll start to collapse on itself from the front. And you may notice this showing up as someone you know shifted like this. That shift is typically due to a scoliosis that's developing within their spine. And the challenging part about this is that these progress at 1 to 3 degrees per year. So by the time you're even noticing that your family member or friend has shifted over, they're probably about 10 to 12 degrees into this, and they've had it for 3 to 5 years. This can be really a challenge in managing the end result, which winds up being pain, because when it shifts and when it degenerates like that, the pressure that's put on the nerves that come out of the side of each of these vertebrae never gets released to it. And even if it winds up getting an epidural where it's sprayed with pain management, as soon as the epidural is complete and the drugs have worn off, then the pain winds up showing up. We've had some really great success in managing these because we take a bit of a different approach. When we see this compression that's occurring, we look to understand, can we distract it? If we can distract it, it's pretty exciting, and patients will notice some changes in their symptoms quick. And sometimes with these, it becomes so severe and so compressed that we need to wind up shifting gears and introduce bracing for them. It winds up being a scaffolding on the outside of the body that we put rather than going in and doing surgery. So if you know someone who's been considering spine surgery, this may be an option that we need to look at. If you or someone you know has had problems with unrelenting lower back pain and they've tried everything that they thought they could, let's connect or ask your questions down below to see if we can find a solution to them to wind up changing the trajectory of their health and their lives. You owe it to yourself to wind up doing it. Once again, my name is Dr. Gregg Gerstin, and I want to thank you for letting me be a part of your health.